The central challenge in homeopathic diagnostics is the sheer volume of overlapping physical symptoms. A practitioner often faces a field where individual signals are lost. The materia medica is vast. Across thousands of distinct remedies, broad pathologies often look identical. A prescription based on a generic physiological complaint, like a standard fever, lacks the specificity required to distinguish between hundreds of potential remedies. To resolve this lack of clarity, Dr. H.C. Allen developed a highly specific methodology. His foundational text, Allen's Keynotes, serves as the definitive guide to this diagnostic system. As Allen wrote in the preface to his first edition, his objective was to render the student's task less difficult and to simplify the study of the materia medica. He achieved this by stripping away generic data to isolate the distinct individuality of each remedy. The text functions as a targeted tool for resolving symptom overlap, isolating the confirmed pathogenesis that defines a single remedial agent. The foundation of the system is the concept of the keynote. A keynote is rarely the patient's primary physiological complaint. It is almost never the loudest or most painful symptom. This network diagram illustrates the keynote principle. It is the uncommon, peculiar marker, what Allen called the red strand of the rope. Locating this red strand requires identifying two major pillars. The first pillar is the patient's modalities. The second major pillar is the patient's mental generals. Precise differentiation relies on identifying these modalities and mental generals, moving beyond the shared characteristics of local tissue pathology. To find the exact simillimum, the practitioner must analyze the specific way the patient reacts to their illness. Modalities are the specific conditions of aggravation, what makes the patient worse, and amelioration, what makes the patient better. Consider a clinical scenario involving a diagnostic tie. A patient presents with severe, aching, intolerable physical pain. Bryonia alba appears as a primary potential match for this pain profile. This matrix shows how to break the tie. Looking at Bryonia's strict aggravation modality, we see extreme worsening from any motion whatsoever. Conversely, its amelioration modality requires absolute rest and lying directly on the painful side. Arnica montana is the second potential match for the exact same physical pain. Arnica presents an opposing modality. The parts rested upon feel sore and bruised. Because of this, the patient must move continually to find a soft spot. While the localized physical pain is identical in both cases, the mechanical reaction, the modality, is the data point that determines the prescription. Another major point of symptom overlap is the presence or absence of thirst during a fever. Allen's Keynotes breaks thirst down into a high-resolution dataset, measuring frequency, volume, and temperature. This chart maps the fluid index. At the baseline are remedies defined by complete absence of thirst, Apis mellifica and Aethusa synopium. Contrasting this is Arsenicum album, high frequency but extremely low volume. The patient takes frequent small sips. Despite suffering from intense internal burning pains, the Arsenicum patient specifically desires cold water. This directly contrasts with Bryonia alba, which features long intervals between drinking, but a massive volume of fluid consumed at once. By isolating these exact metrics, the text transforms a basic bodily function into a systematic method of differentiation. Differentiation also requires an analysis of mental generals, the psychological, emotional, and behavioral state of the patient. Hahnemann established a rule: the moral and mental symptoms of the patient must closely resemble the recorded pathogenesis of the drug. This rule is applied when prescribing Aconitum napellus for an acute fever. Aconite's psychological profile is defined by an anxious, restless fear of death. The patient may even predict the exact day they will die. This state differs significantly from the mental state required to prescribe belladonna for a similar fever. Belladonna's psychological profile features violent delirium, hallucinations of animals, and a drive to strike, bite, or escape. In this framework, the physical fever is secondary. The prescribing factor is whether the psychological state is rooted in fear or violence. Identifying the acute simillimum is often only the first phase of clinical management. This network graph illustrates relational continua, specific pathways linking surface-level acute states to deeper chronic deficits. The text outlines a pathway linking the acute presentation of aconitum to its complementary chronic remedy, sulfur. A parallel pathway links belladonna to its complementary chronic remedy, calcarea. The materia medica functions chronologically. Practitioners use acute flare-ups to anticipate and treat the long-term constitutional shifts occurring beneath the surface. The clinical utility of the text relies heavily on its structural modernization, which was finalized in the 10th edition. In early editions, symptoms were often placed randomly and did not follow a logical sequence. The 10th edition editor reorganized these random arrays into specific, modern systemic headings. For example, the symptom of fecal vomiting was historically filed under the generic stomach heading. Because the primary cause of fecal vomiting is intestinal obstruction, the symptom was relocated into the gastrointestinal system heading to align with modern clinical standards. Through its use of modalities, mental generals, and modern structural organization, Allen's Keynotes provides a clinical framework for identifying individual human susceptibility.